Welcome to Evergreen Family Medicine. We are with Dr. Emmanuel Okenye, and today we're talking about hypothyroidism. First of all, welcome.
Thank you.
Let's define what hypothyroidism is first.
So hypothyroidism will be when you have low circulating levels of thyroid hormones in your body, simply. The thyroid gland, which you probably know about, sits over right beneath your larynx and actually produces these hormones. So hypothyroidism is when you have low levels of this hormone circulating in your bloodstream, basically.
So how does that show up in symptoms?
The hormones we talk about is the T3 and the T4 hormones. When they have low levels of these hormones, they will get more constipated, for instance. They would have more coarse. They might feel like their hair is getting thinner and coarse. They might feel like, they just feel more tired. Some patients don't have any symptoms at all. And that's why it can be a little bit, sometimes tricky to diagnose, because the symptoms tend to run across different organ systems. Patients that have that sometimes will feel like they have just low energy. Their heart rate, the heart is just slower. Sometimes their blood pressure goes up. And when their blood pressure goes up, some of these patients also have elevated cholesterol. And when you have elevated cholesterol, we all know what that does. And so, there are multiple areas and multiple systems that the thyroid hormone actually affects.
What are some of the treatments for hypothyroidism?
So, first you have to test for it. So your doctor would order a test and see if you are hypothyroid. And if you are hypothyroid, he will put you on a thyroid hormone pill. And that pill, basically, you take that pill, and then 4 to 6 weeks later, your doctor will then bring you back into the clinic and retest your thyroid hormones and see if you're at the right levels. If you're not at the right levels, then he would maybe increase the dose, or and just kind of adjust things as they go.
That's pretty good news, I think, for somebody who might be concerned. It sounds like a simple way to treat.
Oh, absolutely. Over the years, we've come up with, it used to be that you had the natural, type pills, and now you have more of the synthetic pills, and now some people are going back to more of the natural type. But basically, it's a very simple way to treat, to treat it.
So what kind of a message should we leave viewers with about hypothyroidism? Do you just want more people to be aware of it, learn a little bit more, maybe be able to communicate better with their doctor? What should somebody take away from this information? Just to be aware that, not to overlook the symptoms whenever they notice that they're getting more fatigued, more low energy, their hair is thinning, they're getting more constipated. These may be, symptoms of hypothyroidism. It's also important that they follow up with their primary care doctor, with their routine checkups, because they're able to, these kinds of diagnoses would not be missed. And that way they can get on top of it and prevent them from getting the complications that can occur with hypothyroidism. Thank you, doctor. Appreciate that information. And it's that kind of information that will help you stay healthy, not to mention communicate with your doctor so that they know how to help you the next time you are at Evergreen. You can learn more about hypothyroidism and other elements of health at evergreenfamilymedicine.com. And you can follow Evergreen online on Facebook, Instagram, YouTube, and Twitter.